Alrighty, hello everyone. Um, Today, well, do you know what? It's been obvious to me for a while. Is something hypermobility. A large percentage of my clients over the years, you guys included, have hypermobility. Now, the weird thing about hypermobility is that some people who are hypermobile have some very stiff joints. Okay, so I will as long as I remember to circle back to that, I'll explain it. And if I haven't explained it by the end, please send me a message and say, "Hey, Pete, you didn't explain that bit." So I bought this book months ago, okay, because I wanted to learn a bit more about fascia. It's very dense. It's very scientific. Um, lots of cool pictures. This is the extracellular matrix, which is cool stuff. Okay, the extracellular matrix is like a communication. It's the stuff that's between cells. Okay, so I've got a cell here and a cell there, and the extracellular matrix is kind of the gooey bits in between, and it's very electrically conductive. It's a bit like our nerves. Okay, but so it sends information around the body. Okay, it sends stuff around the body. Anyway, super cool. I was going to go over hypermobility based on what's going on in this book. So sorry, I should have found this page before I started recording, but I didn't. So here we are. Hypermobility Ehlers-Danlos 393 to 405. 393 to 405. 393. Okay. Loads of technical stuff. Okay. But what I'll do, I did send this through as a picture, and I think I posted about it on Facebook, maybe. I posted about it somewhere, maybe Instagram. So if someone is concerned that they may or may not have hypermobility, okay, particularly Ehlers-Danlos syndrome, okay, you might get a form that looks a little bit like this to fill in, okay, or that a doctor or a physio or whoever is looking at you, testing your body for these markers. This is probably what they'll have on a little check sheet that they need to go through. Okay, so there is something called a Baton test, which is some basic kind of like mobility tests. Okay, so can you get your thumb to your wrist? Can you bend the ends of your digits backwards? Okay, okay, so I've got this. Okay, can you do that? Okay, most people cannot do that. And getting the wrist to go all the way back there and getting the wrist to go all the way over there, that's another big one. The elbow one, as I've said many times, it's one I don't have. My knees are probably okay as well. And there's a few other tests within the Baton test scale. And depending on your age, like the younger you are, the more you need to score to be kind of, let's check the box of hypermobility. And if you're over 50, you need 4 out of 9. If you're between kind of 20 and 50, you need 5 out of 9. And if you're basically a teenager or younger, you need 6 out of 9 to be classed as kind of a positive, which is a bad thing, on the Baton scale. Okay, so it also includes, can you now or could you ever place your hands flat on the floor without bending your knees? Can you now or could you ever bend your thumb to touch your forearm, like I showed you? As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? As a child or teenager, did your shoulder or kneecap dislocate on more than one occasion? If I do this, I can just by doing that, my shoulder, that's a kind of a partial dislocation. If I do that, can I do it on the right side? Yeah, there's like a partial dislocation there. So that's not normal. I shouldn't be able to kind of put my shoulder into that position within this joint. Do you consider yourself double jointed? I can clap with one hand. I am certainly double jointed. So I score very highly on that. Next box. Okay, so that's box 1 is basic Baton test plus those bits I talked about. Box 2, 2 or more of the following features in A, B, or C must be present. Okay, so in A, unusually soft or velvety skin. Yep, soft skin, cool. Mild skin hyperextensibility, stretchy skin. unexplained stretch marks, I'll shorten that one right down, that aren't because of weight loss and weight gain. Okay. I have some of those around kind of the armpit region, chest region. Bilateral pisogenic papules on the heel. If you press your heel, does it come up with these weird, like white and red bumps? Okay. Recurrent or multiple abdominal hernias. Yes, I've had those. Atrophic scarring. Again, I haven't looked up some of these words since I last did this. I did the video on this on TikTok. I haven't looked up some of these words, but atrophic scarring involving at least 2 sites and without the formation of truly papraceous and or hemosideric scars as seen in classical EDS. Don't know the meaning of that. Don't know if I've got that or not. So, and because I can't explain what the meaning is, you probably don't know if you've had that or not either. Okay, pelvic floor, rectal and or uterine prolapse in children, men, or nulliparous women without a history of morbid obesity or other known predisposing medical condition. So do you have problems with your pelvic floor? Do you have problems with urination? Do you go frequently? Have you had some kind of prolapse that's not involving childbirth? Okay. I'm guessing that's what nulliparous women means. Dental crowding and or a high or narrow palate. Now, I have a narrow palate, slightly crowded, okay, but not too much. I've got all 32 teeth, so none have been removed. So my jaw is not particularly narrow. So I would say that's a no for me, but maybe it is for you if you've had teeth removed. Particularly if it's kind of more than 2 or 3, that would suggest you've got a narrow palate and a narrow jawline. Okay? Although that would normally be improved by nasal breathing, tongue in the roof of your mouth, and you kind of push and mewing, okay, which I talked about maybe about a year ago, mewing. Arachnodactyly. Again, I don't know what that word means. Arachno. It's like spider hands. Positive wrist sign on both sides. I think this is kind of like rotation of the wrists and kind of how you hold your arms. Arm span to height ratio is greater than 1.05. So if I was 2 meters tall, is my arm span greater than 2 meters and 1 inch, or 2 meters and 10 centimeters? 2 meters and 1 centimeter. It's really that small. So I'm 6'1" ish, 185 in centimeters. My arm span is about 188, 189 side to side, and so I am above that line on that. Mitral valve prolapse. Again, I've had heart checks when I was 19 before I joined the army, or 18 before I joined the army. Investigating a heart murmur, which is kind of what that was. Okay, what that's explaining. Aortic root dilatation with Z score of greater than +2. Don't know what that means, apart from aortic is probably something to do with your aortic artery. But I don't know what that means. That's probably got something to do with POTS and how blood comes out of your heart. I'm not sure. Positive family history so we're moving on to section B of this big box. Positive family history, 1 or more first-degree relatives independently meeting the current criteria for hypermobility EDS. There's a strong chance brother, sister, mum, and possibly dad all have it. Okay, kids, certainly Maisie, possibly Ida. Okay, almost guaranteed that they've got it. Feature C must have at least one of these: musculoskeletal pain in 2 or more limbs, recurring daily for at least 3 months. Okay, most people come to see me for pain, and it's because they've had pain in multiple areas of their body for more than 3 months. So most of my clients, we can tick that box. Chronic widespread pain for greater than or equal to 3 months. Yeah, we're probably talking more fibromyalgia there, but just chronic pain for a decent length of time. Recurrent joint dislocations or frank joint instability in the absence of trauma. So if you've got punched, or you fall over and you dislocate a shoulder or an elbow or a knee or a hip. That's not necessarily a tick in that box, but if you can walk down the stairs and not fall, but still dislocate your knee, that would be a big tick in that box. Okay, so you need 2 out of 3, and on that part 1 of those 3, you're going to need to have 5 must be present. I score at least 6 on that, so big one there. And feature B, yep, check that one. Feature C, yep, check that one. So far, I'm ticks all the way down, okay, and maybe you are too. Okay, criterion 3, absence of unusual skin fragility. Oh, you need all of these, by the way. Absence of unusual skin fragility, which would prompt consideration of other types of EDS. Again, not entirely sure what that means. This is what makes me think that I don't have EDS, but I do have hypermobility. Exclusion of other heritable and acquired connective tissue disorders. And then there's a big long list of words I don't really understand. Exclusion of alternative diagnosis. Okay, so you might have these hypermobility markers, but not necessarily others. There might be another kind of medical explanation for this. Basically, the rest of the chapter is about how to deal with it. Okay, so according to this paradigm, okay, there's basically the scientific medical physiology paradigm. What to do, particularly if it's been a long-term thing, is stuff like CBT. Okay, so positive, like self-development, positive psychology, stuff we do here. That's one thing. Okay, so where is it? Management principles. There we go. Stress management, self-management techniques, possibly splinting or bracing. Okay, if you're going to dislocate your wrist practically every day, if you're picking up a pen, you're probably going to want a wrist strap, okay, to stop you from dislocating your wrist. Okay, or if your knee dislocates when you're walking down the stairs, and that happens regularly, you're going to want some kind of strapping. Okay, so that's that. Where are we? Cognitive behavior. Yeah, referral to other providers. That means physio, basically. Lessons about body mechanics and joint protection are important to minimize future injury. Okay, and there are simple, intermediate, and complex long-term strategies depending on how long someone's been suffering with these things. Okay, so something that is simple and kind of acute, which means recent but often severe. So like a sudden dislocation, it's never really happened before. So it suggests ice for pain, electrotherapy, again, pain / healing, stimulation of healing in the body, bracing, i.e. tape or bandages or whatever it is, exercise, education, and prevention. Okay, and prevention is exercise. Intermediate, again, education on how the body works, and exercise. Complex long-term multidisciplinary management program using cognitive behavioral therapy, education, and graded functional approaches. So if someone basically dislocates all the time and they've got incredibly poor joint stability, yes, it's going to be harder, but the answer to all of them is exercise. The answer to all is exercise and some kind of therapy. Okay, so whether that's like gentle massage or whatever, but the answer is exercise. So how would I tackle that? Okay, so I am not really in the exercise and rehab field anymore. Okay, but I was. The place I would go if I was looking on social media, the place I would go is functional patterns. Okay, you find them on Instagram. They've got courses online. You can become, I mean, if you're a personal trainer already, I don't think anyone, well, no, there is at least one person in here who's a personal trainer already, but you can get education from them or him. Okay, as a person, I don't particularly like his attitude. Okay, he's like, everyone else is wrong and I'm right. Okay, but he's right about a lot of things, but also wrong about others. Okay, so there's that. I just want to add here that just about every gymnast is hypermobile, probably hypermobility with EDS. But it's through their strength training and their agility and the proprioceptive awareness of their body. They know where their hand is at every moment, okay, because they need to, because they've got to do a handspring, okay, and they've got to land on a beam, and they've got to, catch a bar when they're done like 1.5 somersaults, like all the crazy stuff that high-level gymnasts do. So their proprioceptive awareness of their body is incredibly high. The strength in their, so even though they have hypermobility and laxity in their joints, because of the strength that they've developed in their muscles and their tendons and their other tissues that hold everything together, they don't fall apart as much as they probably should, okay, considering how bendy they are. So this is why I recommend dancing. I recommend stuff like animal movement. I recommend things like martial arts with a focus on, you don't want to be doing a martial art that's about striking. Okay, so you don't want to be sparring, okay, in a martial art, but a martial art, because that's really bringing in some proprioceptive awareness of, where my body is, what all my joints are doing at one time. Okay, slow, conscious movement. So if you're lifting and doing exercise, it's not running necessarily. It's going to be lunges with small weights. Okay, it will probably look easy, particularly as a beginner. Okay, as you advance, yes, you can put the weights up. Okay, but the weights at the beginning, okay, someone who's new to exercise but has hypermobility and EDS, is you don't want to be slinging those things around. Okay, you don't want, even though you could possibly do an exercise with 20 kilos, for example, you want to bring that right back to a 10. Okay, or if it's a 10 that you could do it with, because the strength is there, physically in the muscles, the strength is there, you bring it back to a 5, and you do it in a really slow and controlled way, and you do it in a way that's going to bring proprioceptive awareness. So I'm not just bringing the weight up to, let's say it's a lateral raise, I'm not just bringing the weight up to the side and bringing it back down. I'm bringing it slowly up to the side. I'm doing maybe something else with my arm, taking it back out to the side and then coming back down. Okay, and I'm making it a whole body movement. Okay, and I'm rotating and I'm bending, okay, and my body is transitioning through different planes of motion. This is what functional patterns is really good at. So stuff like exercise bands as well. So you put tension on a band, okay, so this would be for my back. If I've got a band in my hands here, I pull that band apart, and then I pull that band down as if I'm doing a push-up, and then I push that band back out, and it's all nice and slow, okay, and the band and the tension that's built up through the band and in the muscles creates proprioceptive awareness. Okay, so proprioceptive awareness comes from moving the body. And also, if we add tension into there, think weight, okay, but it doesn't have to be a physical, like a dumbbell weight, okay, some kind of weight, could be body weight. That's how we, again, increase the strength of the tissues that are holding the body together. Done consistently over a period of time. Okay, yes, obviously we want to look for progression. Okay, so we're going up from 2 kilos. After a couple of weeks, it's 3 kilos or 4 kilos, or in terms of if it's bands, you go from a very light, easy band to a more medium, some kind of moderate band, eventually up to a heavy band. Okay, one that's got much more strength in the elastic, a much more stiff band. And equally, you can use body weight exercises, but again, you need to progress them. So you don't start off with a full plank, even though technically maybe you could do it and you've got the core strength to do it. You start off with a kneeling plank on your elbows instead of flat out on your hands, because your elbow, it wants to bend backwards and it wants to do kind of the wrong thing. Or if you do have the strength, you intentionally do a full plank, but you just bend the arm slightly so that it doesn't go into full lock. And over time, you build up into that full lock, because you know that those muscles and tendons and ligaments and fascial tissues have now tightened, and the word is tensegrity. It has enough tensegrity to hold everything in position without dislocating. So that is how to deal with that. Okay, and another one of the kind of the symptoms of hypermobility is you are tired all of the time. Okay, because of how our body uses energy. Okay, so ligaments hold bone to bone. Okay, so if this finger's a bone and this finger's a bone, I've got a ligament in between the two, which holds them together so they don't basically dislocate and slide apart. Okay, in hypermobility, the ligaments in between. Let's do it over here. Okay, okay, the ligaments are a little bit lax often. Okay, the muscles and tendons can also be lax as well. Okay, and the veins and the arteries and the digestive muscles of the digestive system as well. Okay, and the enteric, so the fascial tissue that holds together your intestines can be weak as well. So you kind of like your guts are just maybe just in the wrong place, and things get a bit twisted and knotted in ways that your body doesn't really like. Anyway, I digress a little bit. So the ligaments are a little bit lax. So what does that mean? That means the muscle that's over here. Okay, let's say it's a bicep. Okay, the muscle over here, the bicep, it starts here and it crosses onto this bone. It attaches here. Okay, because the bicep wants to do that. Okay, it wants to bend one bone towards the other. So let's just do it in real life. Okay, so there's ligaments in here, muscle here, tendon here, running down into my, I forget whether it's the ulna or the radius, it doesn't really matter. Okay, it's going to pull bone towards bone. Okay, so tricep is going to take bone away from bone. Okay, where was I going with that? Yes, the metabolic activity, the amount of energy it takes to do that. Okay, so to stabilize, ligaments are very low maintenance. Okay, they don't take much energy to hold things in place as long as they're working well. If they're not working well, the thing that has to do it is the muscles and the tendons, and the muscles and the tendons take much more, significantly more energy to do the same thing as a ligament would. Okay, so ligaments are very short, they're very strong, usually. In hypermobility, they're still very short, but they're a bit weaker. They're a bit more bendy than they should be. So the amount of energy your body has to use as a person with hypermobility is more. Okay, there is a benefit. It's harder to gain weight. Okay, because your body is naturally expending a bit more energy just to stay held together and not just completely like dislocate every time you move. So there's benefits. It's harder to gain weight. It's still possible to gain weight, but it's harder to gain weight. Let me just scan through. Yeah, it says right in the summary, this exists as a spectrum. Okay, a bit like autism, really. Okay, some people are. They're autistic, but they're able to function at a high level. They're able to, hold down jobs easily. They're able to stay in employment and have jobs and not really struggle too much. And then other people on the autism spectrum are basically disabled. They can't really do anything. And maybe they're non-verbal. Maybe all kinds of different things going on. So hypermobility and EDS are a spectrum. I'm on it. You're probably on it because you wouldn't be here. It's highly unlikely you'd be here if you weren't on it, because most of my clients are. It's incredibly common. Self-management and injury prevention. Tissue fragility may reduce patient tolerance to intervention, such as exercise or manual therapy. So sometimes that's not the best thing for people. And patients are likely to progress more slowly than non-hypermobile patients. Okay, so it's going to take longer to build strength in someone with hypermobility than someone without hypermobility. Yeah. Okay. So this book, it contains so much. Okay. Some of it I kind of know. Some of it I don't really know. Some of it's just way too complicated for me to even bother to learn. I can't remember how much it was. I think that was about 35 quid, 40 quid. It's, unless you're a physio or a therapist who's really keen on this, don't bother buying it. However, I'm going to move on to another thing. Let's chuck that down there. And this is something I've mentioned a couple of times in the not too distant past. Okay. Hopefully we've all heard of this guy, David Hawkins. Okay. This is the book. If you're going to get one of his books, this is the one to get. Okay. And the thing I've talked about in the past is him overcoming his own conditions. Whether he repaired his own eyesight, he was short-sighted, and then he kind of, one of his students challenged him. It's like, why do you still wear glasses? Okay, because he was talking about this kind of stuff. Why do you still wear glasses? And it was at that point he took them off, and then 6 weeks later he had his eyes tested and he was back to 20/20 vision. He did nothing. He did no eye exercises. He did all he did was he basically took his glasses off and refused to believe that he needed glasses. He even drove, which is, I think this is the bonkers bit. He even drove without glasses. I don't know how short-sighted he was. I don't know if he was like -8 or +8 or whatever it was, which is really significantly short or long-sighted, or if it was like me when I wore glasses before I had my eyes lasered years ago, that it was like -1.5, 2, okay, which wasn't too severe. I still needed glasses to drive, but I could probably have got on with the rest of my day without, usually. So this is part of the introduction to this book. And yeah, in another book, he uses basically the same thing but talks about himself. So it's like he went and did all of these things that I'm about to list. Okay. So I'm just going to read for a bit. It used to be that we could count on social institutions, okay, like the NHS or whatever, okay, but they have had their day. Nobody trusts them anymore. We now have more watchdogs than institutions. The hospitals are monitored by multiple agencies. Obviously, it's based in America as well, so it's slightly different. Nobody has time for the patients who get lost in the shuffle. Look down the corridors. There are no doctors or nurses. They are in the offices doing paperwork. The whole scene is dehumanized. I should add, this was written in the 2000s. Well, this is speech marks. Well, you say, there have to be some experts who have the answers. When upset, you go to a doctor, a psychiatrist, or an analyst, a social worker, or an astrologer. You take up religion, get philosophy, take the Erhard Seminars training. Don't know that one. Tap yourself with EFT, get your chakras balanced, try some reflexology, go for ear acupuncture, do iridology, get healed with lights and crystals. He's essentially saying none of this is necessary, okay? You meditate, chant a mantra, drink green tea, try the Pentecostals, breathe in fire, speaking tongues, you get centered, learn NLP, try actualizations, work on visualization, study psychology, join a Jungian group, you get Rolfed, okay, with Rolfing, try psychedelics, get a psychic reading, jog, okay, it goes on for about 4 or 5 paragraphs going through this, okay? I'll just come to this because there's like 2 pages. You and your friends have tried all of the above. Oh, the human, you wonderful creature, tragic, comic, and yet so noble. Such courage to keep on searching. What drives us to keep looking for an answer? Suffering? Oh, yes. Hope? Certainly. But there is something more than that. Intuitively, we know that somewhere there is an ultimate answer. We stumble down dark byways into cul-de-sacs and blind alleys. We get exploited and taken, disillusioned, fed up, and we keep on trying. Where is our blind spot? Why can't we find the answer? Here's the answer to that. Okay, we don't understand the problem. That's why we can't find the answer. Maybe it's ultra simple, and that's why we can't see it. Okay, we're not looking for simple, we're looking for complicated, aren't we? Okay, so we like complication because we're human. Okay, maybe the solution is not out there, and that's why we can't find it. Maybe we have so many belief systems that we are blinded to the obvious that we can heal, and that's not said in the book. Okay, we can do it ourselves. It's all down to us. Okay. Throughout history, a few individuals have reached great clarity. We're talking Jesus, Buddha, etc., and have experienced the ultimate solution to our human woes. How did they get there? What was their secret? Why can't we understand what they had to teach? Okay, because when you read mystical texts, it's from like enlightened masters. It's very often very difficult to read and hard to, and you don't always get the message. Okay, because the message it's hidden it's in stories. Okay, and you've got to sit there and analyze them. It's why I'm studying philosophy. What about the average person who is not a spiritual genius? Let's see, what else was there? Confusion is our salvation. For the confused, there is still hope. Hang on to your confusion. In the end, it is your best friend, your best defense against the deathliness of others' answers. If you are confused, you are still free. If you are confused, this book is for you. Okay, I hope you're confused. I am certainly confused. Yeah. It's not by finding the answers, but by undoing the basis of the problem. Okay, he's going back to the original thing that there is a problem to have in the first place. There is no problem. There is no problem. We created it. Okay. The mechanism of surrender is simple and the truth is self-evident. It works. It works during daily life. There is no dogma or belief system. You don't need a religion. You don't need medication. You don't need anything. Okay. You verify everything for yourself, so you cannot be misled. There is no dependence on any teaching. It follows the dicta of know thyself. The truth shall set you free, and the kingdom of God is within you. Boom. It works for the cynic, the pragmatist, the religionist, and the atheist. It works for any age or cultural background. It works for the spiritual person and the non-spiritual person alike. Eventually, you will discover your inner self. You always unconsciously knew it was there. When you come upon it, you will understand what the great sages of history were trying to convey. You will understand it because truth is self-evident and within your own self. It's okay to be skeptical. Be as skeptical as you like. It's advisable to avoid gushing enthusiasm. It's usually a setup for a letdown later. Quiet observation will serve you better. Okay, so I think for the last year, I've been much more on track with this. Whereas the previous 3, 4, 7, 8, 9 years, I wasn't. Okay, but I wasn't ready to go there at that time. Okay, I hadn't reached that point. As you can see from this book, okay, I have folded many pages, and I think in the past, because I've read this book 2 or 3 times, I think 3 times, I've unfolded pages and folded different pages. So in the, we don't need the last, all the appendices at the back. Don't worry about those. Oh yeah, here we go. Here's his list of diseases that he had but at the age of 50. Migraine headaches, chronic and frequent, blocked eustachian tubes, painful earaches, nearsightedness and astigmatism, trifocals were prescribed, sinusitis, postnasal drip, allergies, dermatitis of various types, gout attacks. It was necessary to carry a cane in the trunk of his car and to have a restricted diet. Cholesterol problems, further restrictions in diet. Duodenal ulcers, chronic and recurring for over 20 years, unresponsive to all medical treatments. Pancreatitis, gastritis, colitis, diverticulitis, common problems at the lower end of the gastrointestinal tract. He was scheduled for surgery. I assume didn't do it. Arthritis of the cervical spine, your neck. Lower back syndrome. Don't know what lower back syndrome is. Basically back pain. Vibration disease, okay, also known as Raynaud's syndrome. Loss of sensation and basically cold fingers and toes, and they go blue. Sorry, they go white and your hands go blue. Middle age syndrome, coldness in hands and feet, loss of energy and libido and depression. So his diagnosis is, so he was in his 80s when he died, which was in 2012. So if we're talking 30 years prior to that, we're talking the 70s and 80s. So what we call things now might have been called something different in the 70s and 80s when he was diagnosed with these things. Pilonidal cyst at the base of the spine, curable only by surgery. I'm guessing he didn't have the surgery. Bronchitis and chronic cough. Poison ivy sensitivity, athlete's foot. Dandruff. Inflammation of the cartilage. Rare disorder. It's called Seetze's syndrome, which is a rare disorder with painful swelling at the junction of the rib and the sternum. Dental and gum problems, loss of bone around the base of the teeth, surgery is recommended for the gums. Overall energy imbalance. Kinesiologic testing revealed that all of the energy systems were out of balance and every meridian tested weak. Okay, so he's talking about muscle testing there, which is obviously what I do, not so much anymore, but what I did do in person with people. So those were his diseases and diagnoses. Okay, reverse them all with the methods that he describes here. All of them. I'm just going to come to a page. There was a few I flipped to earlier before coming on live. Sometimes we feel stuck with a particular feeling. Simply surrender to the feeling of being stuck. Okay. So let's say anxiety is common in your life. Okay, and you're going, oh, I've been meditating, I've been doing this, I've been trying, X, Y, and Z techniques to try and solve this problem and solve the anxiety. And you come to the sudden realization, I've been stuck on this. And then you surrender to stuck. It's like, oh, I'm stuck. Oh, okay, well, I'm stuck. Oh, fine. Just let it be there and don't resist it. If it doesn't disappear, see if you can let go of the feeling in bits and pieces. Another block that may occur is the fear that we let go of a desire for something, that if we let go of a desire for something, we won't get it. Okay, so let's say, I don't know, you desire weight loss. Okay, some kind of a mental image of a perfect body, or a body appropriate, the body that you would be happy with, let's say. Okay, so if we let go of the desire for that, we won't get it. Okay, if I stop desiring a healthy body, one that I prefer, I won't get it. Okay, so that's, or it could be money, it could be a thing, it could be a fancy car, a nice house, whatever it is. Okay, it is often beneficial to look at some commonly held beliefs and let go of them in the beginning, such as, okay, I've talked about this. We only deserve things through hard work, struggle, sacrifice, and effort. Okay, you do not need to struggle, sacrifice, and effort to get the things you desire. Okay, suffering is, so that's the belief to work on. Okay, so the belief that through struggle and striving and effort, that's the way that we get the things that we desire. Not true. Okay, suffering is beneficial and good for us. Okay, this is an Andrew Huberman thing. This has come up recently. There's what's the anterior cingulate nucleus? Okay, it's the bit of the brain that kind of fires up when we're doing something hard. Okay, doing something that we don't want to do. The Goggins effect. Okay, David Goggins. If you've heard of David Goggins, he's like this ex-US Navy SEAL. He was a big fat teenager. Basically, had a really tough childhood. Decided he was going to join the Navy SEALs. Failed again. Eventually he got in. Okay, this guy runs 250-mile team races on his own. Okay, this guy's an absolute lunatic. Okay, and his knees are absolutely blown apart. There's like the cartilage in his knees is gone. Okay, but he still does all this stuff. He's absolutely crazy. Okay, suffering is beneficial and good for us. Not true. Okay, we don't get anything for nothing. When was the last time someone gave you a gift on your birthday? You got something for nothing then. Okay, you got born, right? That was something for nothing. Things that are very simple aren't worth much. Okay, as I was saying earlier, we like complexity. We get great pleasure in doing something that was really complicated and hard. And then we can tell the story, look, I overcame this really hard, complicated thing by doing this hard, complicated process. And then we go, haha, look, I've got my gold medal in hard and complicated. Look at me. I want a gold medal in doing stuff the easy way. I want a gold medal in doing stuff the easy and fast way. And yet most people want a gold medal in doing stuff the hard, complicated, really long and difficult way. So letting go of some of these psychological barriers, beliefs, we would call them probably nowadays, to the technique itself will allow an enjoyment of effortless and ease. And here's a little bit in italics on another page. Okay, inside of us, but out of awareness, is the truth that, in quotes, I already know everything I need to know. I already know everything I need to know. Okay, the constant search for answers. We're always looking for answers. Okay, the constant search for answers leads us to a constant stream of questions. And if we never stop asking questions, we will always have questions to answer. Hang on. Right. Sorry. Right. Forgotten a little bit where I am. Okay, but something like a little phrase came to me this morning. In fact, two. I need to go and find the second one in a moment. Okay. I only keep what I care about. Okay? I only keep what I care about. Okay? So the things, again, I've said this many times, and just in different ways. Okay? The things that keep showing up in our life are the things that we invest our thoughts and emotions into. When a thought about yourself or about someone or a belief about something being hard or something being difficult or whatever it is, okay, you don't like a person, whatever it is, okay, if you can in the moment, catch yourself, okay, because you're probably going to start going into a little repetitive thought pattern of, this is what I think about this person, this is, I'm going to start telling a story in my head, okay. It's always like this. Da, 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 da. Okay, this is hard. This is impossible. This is never working. Da, da, da. Okay, nothing's changing, etc., etc., etc. Okay, all this hard work I'm doing, all this meditation I'm doing, all this exercise, all this changing my diet, all this calorie counting, all these courses, all these things. Okay, nothing's working. Okay, you catch yourself. Okay, because by thinking about it, you're putting energy into it. Okay, and here's another step to that. Okay, you will probably miss it in the moment. You'll probably miss it in the moment. Okay, but later that day, maybe an hour or two later, or maybe when you're hitting the hay at the end of the day, your head's hitting the pillow. You go, oh gosh, yeah, that thing happened earlier. Do you know what? What I'm going to do, instead of investing more energy into it and thinking about the problem even more, and really making one of the worst parts of my day the last thing I think about. I don't want to do that. I'm going to forgive myself for forgetting forgetting to de-invest the energy and the thoughts and the emotions into that whole thought process that I had. Okay, I'm going to forgive myself that I forgot to do that. And the other thing, I just need to scroll away to another page briefly. And as long as that page opens up quickly. Yeah. Okay. That was it. My search is over. My search is over. When your search is over, you don't need answers anymore. You don't need questions. You don't have problems. If you don't have a problem, you don't need a solution. My search is over. The answer is already within me. Okay, I'll come back to that phrase. Okay, I already have the answer. Okay, the answer is letting go, really. The answer is de-investing the energy and the thought and the emotion into the so-called problem that is existing in our life. So even if you miss it in the day, okay, even if you miss it in the moment, even if you do have an outburst of anger or fear or high emotion or overpowering emotion, let's say, such like sadness and grief or whatever it might be, fear, any of those. Okay, at the end of the day, forgive yourself. Okay, I forgive that I forgot to de-invest. I'm looking for peace. I'm looking for calm. I'm looking for joy in my life, and you remind yourself of that. At that point, okay, it doesn't matter that you missed it in the day. Okay? Time kind of doesn't exist. There's only a now. Okay, so again, the way I've described this in the past that seems to make sense to me is that to make sense of that is only now. If I remember a period of my life from 6 months ago, this morning, 5 years ago, 20 years ago, 30 years ago, if I remember an event, okay, I am living it again now. Okay, so I've taken that event from however far back in the past and I've brought it into the now. Okay? And I start thinking about it, I ruminate about it. Okay, whether it's good or bad or whatever, whether it's a happy memory or sad memory, makes no matter. Okay, I've taken something from the past, okay, in linear time, and I've brought it into now. I've kind of looped it into the present moment. Likewise with the future, okay, because we can project our mind into the future. We generally call that anxiety. Okay, I'm projecting my mind in the future. If this doesn't change, if that doesn't change, if I don't do this, if I don't do that, if I don't, I'm going to be overweight and old and obese and sick and have diabetes and gout and arthritis and okay, all these terrible thoughts we might have of ourselves, okay, or our health, or money or relationships or whatever. Okay. So again, I'm taking a future possibility. Yes, it's possible that those things may happen, and I'm bringing them into the now. Okay, and I'm making them real by bringing them into the now. Okay? So forgive yourself for not being present. Forgive yourself for not being in the moment. Forgive yourself for putting yourself into the past or into the future, and kind of making predictions about what the next moment or tomorrow or a month or 5 years from now will be like based on the past. Right? Okay. I still do this. I'm not perfect. Okay. But I'm getting better at recognizing it. I'm getting better at pausing in the moment and going, hang on a minute. I need to bring myself into the now. Okay. Because my reaction in this situation is based on the past. And it's based on past thoughts and beliefs and feelings. Okay. And that's why I'm responding in this way in this moment. But I don't have to. I can pause and get present and go, right, and start removing the emotion from it. I don't catch it every time. And that's where we can go, I forgive myself later in the day. Okay. You can go, okay, yeah. That happened earlier. Okay. Silly me. Okay. Silly me. And we don't invest more energy. You don't blame yourself. You don't get guilty about it. You don't go, oh God, woe is me. I should have done this and I should have done that and I should have said things this way and I should have avoided that situation. And oh, if only I'd have done these things right 3 months ago, I wouldn't be in this situation now. Mind exploding, anxiety, and depression and anger and all these kinds of things. Okay, so your search is over. Okay, my search is over. No more questions, which means no more answers. Okay, well, no more answers. You don't need to look for answers because there are no more questions because your search is over. Okay, so that might be a little bit mantra. Okay, so I know my search is over. I have no questions. My search is over. I know the answer. Okay, it's in me. It's in my feelings, in my emotions. Okay, it's in my it's in my ability to let go. So very long lesson in comparison to the recent past, but some very strong advice. Yes, we've got the fascia bit and the hypermobility bit and the kind of the things to do with that. Oh, I needed to rewind. Why are some people stiff with hypermobility? Okay, it comes back to this bit. Okay, so if the ligaments are lax, okay, and the muscles aren't very strong, okay, the muscles are not very strong, okay, in this situation. Okay, what the brain will do, the brain will recognize, hang on a minute, the ligaments are a little bit lax. Oh, the muscles and the tendons are not very strong here either. Oh, now I've got some worry. So what it's going to do, it's going to lock them. Okay, it's going to go, I'm not going to let you move because if I let you move, you're going to dislocate. Okay, you're going to tear a muscle. You're going to break some tissue. Okay, I don't like this. So it will lock someone down. Okay, oddly, that's usually in the lower back. Okay, that's usually in the lower back. Okay, but it could be a shoulder. It could be a hip. It could be a knee. It could be anywhere. It would just go. No, I don't. The brain will put the brakes on even further, and it'll go, no, I don't. No, you're not strong enough to do this. So it will stop you before you damage yourself. Okay, and it will take, instead of a mild amount of pain and stiffness now, it will take that over and above the risk of significant injury in the future. So your brain would rather have you in pain constantly. Your brain would rather have you in pain constantly than to dislocate your arm. Okay, because if you dislocated your arm and it went really wrong and it didn't go back into place properly, that might cut off blood supply. That might do nerve damage, which may never return. You might lose an arm because of that. Okay, but if you're locked, okay, in your shoulder, it's not going to allow you to do that. It's not going to allow you to lift up anything more than a couple of kilos because it's like, you can't do that. Okay, because I don't want you to dislocate and I don't want you to snap and I don't want anything to happen, because that's a much longer road to recovery and the risk is far too great. So the brain is a risk manager, okay, and it wants you to live a long life, okay, but not necessarily pain-free. But the power of letting go and the kind of the second part that we've just talked about, we can start removing that. Okay, we can start removing that. So these things are not fixed. Okay, so even though someone may have hypermobility EDS, it's not fixed. It's not. And when I say not fixed, I mean it's not like nailed on. Okay, it's not fastened to you. Okay, it can be unpicked. It can be changed. Okay, and yes, through exercise and strength, these are management techniques. Letting go is a reversal technique. Letting go is a reversal technique. So I'm going to end it there because that's nearly an hour. Okay, so we're going to jump into treatment. I hope you've enjoyed this longer session. Maybe you've broken up into a couple of parts, but I'll see you later. If you've got any more questions about any other conditions or whatever, okay, I might read through the power of letting go again soon, so that I can, I don't know, just have a third or a fourth go through and see what's in there. Have a lovely, wonderful day.